want to share with you today an incredible story of a man who was accidentally diagnosed with multiple sclerosis after having an MRI for a research study, who went on to develop symptoms and was inspired by his experiences to train as a physician and is trying to become a neurologist now, and even underwent hematopoietic stem cell transplant for a condition that was diagnosed completely on accident. And this is written in first person by now Dr. Daniel Matterson. The first thing I want to point out is there's someone named Daniel Matterson who is in the news recently at the time I'm filming this. This is a complete coincidence. It's a different person with the exact same name. As an aside, I actually sat next to Mila Kunis in 9th grade geometry, but that's a story for another day. But anyway, the title is, I volunteered to have an MRI. It revealed something sinister. September 18th, 2023. Hitting publish on another candid Instagram post. I wait for the likes and messages that will inevitably follow. Except I'm not an influencer. I'm the MS doctor posting on my Instagram account about my unusual life as a 32-year-old working healthcare professional with MS. And while I never give medical advice, I try my best to normalize MS and help other people with a neurological condition affecting around 130,000 people in the UK feel less alone. So prevalence of MS in the United Kingdom is around 1 in 1,000, a little bit less common in the United States where it's around 1 in 500. But I didn't always feel this empowered. Though my diagnosis has completely changed the course of my life and since inspired me to become a doctor, the shock of the day I found out is etched onto my memory. And this is very common. A lot of people with MS say they can remember the exact day they were diagnosed very well. Not long after graduating as a radiographer back in 2013, I secured a job at a hospital in Edinburgh and started dating Leoana. So I think a radiographer is what we might call a radiology tech in the United States, someone who does x-rays and MRI scans and CT scans, that type of thing. I was 23 and things really seemed to be falling into place for me. Just a couple months into my new role, I volunteered to take part in a study at the hospital which involved having an MRI. Who doesn't want to see a picture of their brain after all? Hey, I'm a neurologist, I haven't seen my brain, I probably would have volunteered for the same exact study. The scan went ahead as normal, and I didn't give it a second thought until a couple of days later when my boss asked to see me urgently. And here you can see a picture of Dr. Matterson. I panicked, assuming I was in trouble, but when she sat down and said, "Daniel, are you feeling all right?" I knew something much more serious was going on. She delicately explained that they'd found a lesion. Now, there's this phenomenon that's known as radiologically isolated syndrome, RIS. I have a separate video about this exact topic in the comments below if you want to take a look. And it's this idea that more and more often we're seeing people as neurologists who have a scan for a different reason, maybe a head trauma, maybe migraine headaches, and it ends up showing lesions that are highly typical of multiple sclerosis, but the person denies having any symptoms. Now, sometimes they do have symptoms. They retrospectively say, yeah, I had an episode of numbness from the waist down, it went away, or I had an episode of vision loss in my right eye, it went away. And maybe the neurologist like me examines the patient and clearly they have multiple sclerosis. The symptoms just weren't that severe and they never sought medical attention. But some people really have no symptoms and their examination shows no sign of injury to the nervous system. And the idea is that sometimes MS isn't that severe and sometimes the symptoms manifest later on. And there are even rare instances of autopsy studies showing lesions consistent with MS even though the person lived their entire life without any symptoms. Of course, this is very rare. And sometimes MS symptoms can manifest many years later or just be relatively mild. For instance, I have one patient who had optic neuritis at age 30. She didn't think much of it. She went on with her life, never had a diagnosis of MS, and then in her mid-60s, she developed some other symptoms and was ultimately diagnosed with MS. So she really had MS for 35 years, but she didn't really know it because it wasn't very aggressive. And of course, if she hadn't had optic neuritis, she essentially could have gone her entire life not knowing. And we don't necessarily know what to do in people who have RIS. We know there are certain risk factors for developing clinical MS, such as having spinal cord lesions, having oligoclonal bands in cerebral spinal fluid, or being younger is interestingly associated with greater risk of conversion to clinical MS or clinically definite MS. Some people actually don't go on to develop symptoms. And there's actually new evidence that treating RIS may be beneficial. For instance, there's a clinical trial with the drug Tecfidera showing it can actually decrease the risk of getting symptoms of MS. Now, more typically, when this happens, people have many lesions. He's saying he had a lesion, which is not typical, although maybe he means one prominent lesion and other not as specific lesions. I don't really know. More typically, someone with RIS would have numerous lesions on MRI of the brain. As a radiographer, I knew enough about MS to know what that meant. Your own immune system begins to attack the myelin, the insulation that surrounds your brain and spinal cord, and allows messages to be sent along the nerves. This means the messages that are sent from the brain take longer to reach their destination or may not reach it at all. This results in a range of symptoms from tingling and numbness to weakness and ultimately loss of function. Everybody is different, and symptoms often present in a unique way for each patient. No two patients are alike. That's definitely true. There's no cure, and scientists aren't sure what causes it, but it's most commonly detected in adults between 20 and 50, although children and old people can have MS too. This is all true. We know some risk factors of MS like Epstein-Barr virus, low sunlight exposure, low vitamin D levels, smoking, family history of MS, but there's no known single definitive cause. It's probably a complicated disease with many causes acting in concert, environmental and genetic factors. I was in complete shock, not least because I felt healthy. Mainly, it was because the people I saw with MS had nearly always been older or disabled, certainly not like me. I felt scared and devastating. Now, to me, this seems a little bit strange. I'm a neurologist. I see kind of everyone with MS, including young, healthy people. So I see a lot of people with MS who are doing very well. But I could understand someone who's not someone who would have a ton of clinical experience with MS, him at this time in his life, could really not know that a lot of people have MS because they don't have symptoms, they don't necessarily disclose their diagnosis. There's sort of a bias in who you know has the diagnosis. One of my friends is a urologist, and he told me that virtually every single patient he sees with MS uses a wheelchair, and that's because people with more severe neurogenic bladder, with more significant spinal cord injury are more likely to see urologists. And I told him, you have a very biased perspective. A lot of people are doing quite well. And of course, what he's experiencing, feeling scared and devastated, is understandable. And a lot of people experience this in different ways. They get an incidental finding, and it sometimes becomes difficult to know what to do with it as a physician. I would actually argue that in general, sometimes doctors tend to overestimate the significance of incidental findings, though as you'll see in this case, it was 100% serious. I have actually personally experienced this, not something as dramatic as this, but just having an unexpected incidental finding. I'm not ready to disclose that to the public, but it happens. It's more common than you might think, and it can certainly be nerve-wracking. I also didn't know how to break the news to people. My parents were one thing, but I assumed Leoana would leave me, and I wouldn't have blamed her. I didn't know what my future would look like with MS, and it was a lot to ask of someone I just started dating. My experience is a lot of people stay with their partners even if they haven't been together that long, but of course I could understand how he'd be worried about it. Yet she chose to stay by my side and help me process the news with unwavering love and support. So he definitely got lucky with a great partner. As reality set in, I tried to get more answers about both the disease and my future, but I was to discover one of the cruelest features of MS, that nobody can give you a reliable prognosis. That's definitely true. There's some young people with relapsing MS who are stable for decades and live a great life with minimal problems. Of course, in others, it could be more aggressive. And there are predictors of prognosis. For instance, people with more weakness and bladder symptoms and spinal cord lesions early on tend to do worse on the average. People who acquire more disability early on tend to do worse. People with progressive MS on average do worse than people with relapsing MS. But these are just correlations. There's really no strong predictor, particularly in a young person early in the disease. Strangely enough, just 6 months after my diagnosis, I started to experience symptoms. It's possible the stress of the diagnosis triggered them. I struggled to feel the use of my hands for months. It was frightening, and because I have relapsing remitting MS, my symptoms come and go in distinct relapses. And my experience is this symptom of numbness in the hands or feet can be quite significant. You would think that weakness would be more disabling, which it is on the average, but numbness can really affect balance, coordination, use of the hands, especially if it's severe. And so he's not the only one experiencing this. Although this made life unpredictable, I made a big decision. I was going to apply to medical school and become a doctor. This happens to a lot of people. They get inspired by their own experiences. If you want to check out my book, Resilience in the Face of Multiple Sclerosis, the protagonist of Chapter 2 is actually a neurologist with multiple sclerosis who is inspired to go into neurology because of her own experiences. She had her symptom onset very young. This book is free on Amazon. I wanted to highlight that MS was not the end of the road by proving that I was still living. I wasn't even sure if I'd get in. It's very competitive after all, but I was confident my experiences would make me a better, more empathetic doctor. Sure enough, I made the cut and began my training in 2016, age 25. And so he's a little bit of a non-traditional student, but not that old. I was 21 when I started medical school, but one of my classmates was 51, and I knew several people who were around 10 years older, and you could still have a great career. So 25 is the norm these days, I would say. A lot of people take a few years off for research or other, clinical experience anyway. I kept my condition private at first, but in my third year, I ran the Great North Run to raise money for an MS charity as my way of coming out to people who didn't know. My university was very supportive. Clinical practice was a bit trickier, but I never worked nights or weekends, which helped. So there are a couple things going on here. One is this idea of being out with your MS, and everyone's different. Some people, right when they get diagnosed, they tell everyone. I actually have a patient who her own spouse does not know that she has multiple sclerosis, and she's done well. She's been stable. She takes a medication that is not a pill, it's an infusion, and so there would be no way for her spouse to find out. And I think that's sort of a cultural thing where maybe she feels some sort of shame in it. Very unfortunate in my opinion, but hey, who am I to judge other people's cultures and preferences? And some people have very negative experiences coming out. For example, the protagonist in my book, she actually describes that when she applied to medical school, they kind of knew that she had multiple sclerosis because she had done a lot of volunteer work for multiple sclerosis foundations. And some people kind of pressed her on it a little bit and made her feel somewhat uncomfortable. On the other hand, I think people who are out can feel like they're not carrying a heavy burden and get more support from other people. And I think one of the benefits of him being open about it is he's normalizing it and making other people feel more comfortable. Of course, it's a personal choice, but I think he really is helping people by sharing his story. The second thing he mentions is that he seemed to get some kind of accommodation where he didn't have to work nights or weekends. I'm not sure exactly how it is in the United Kingdom. In the United States, typically when you're a first or second year medical student, there's very limited clinical experience. It's mostly classroom work. And then when you move on to the third and fourth years, you do clinical rotations, and working nights and weekends would be a requirement. Of course, it may be possible to request accommodations based on a medical condition, and a lot of people get various accommodations, but you may get something like flex time where you're able to complete the program for over a longer period of time. You may get some days off. I don't think it would be very easy to get that kind of accommodation, never having to work nights or weekends in the United States. It's just sort of the culture of American medicine. Just to give an example, when I was an intern, and this is in 2009, I rotated in a particular specialty. I won't name the specialty because I still work within the same institution. And over the course of a month, I was on call 5 times. overnight call. And at the time, there was actually a law where you could not make a medical resident work for more than 30 hours straight. It's like 30 hours, you got to send them home. It doesn't matter what's going on, you got to send them home. And I actually worked more than 30 hours 4 out of the 5 calls, which in my opinion is extremely malignant and abusive and just shouldn't happen. And things have changed since then, but I just want to kind of share with you the culture of American medicine. And unfortunately, I don't think that people would make that sort of accommodation in the United States. But at the same time, I had a co-resident who got pregnant, missed a bunch of time, and people helped her out quite a bit. So, it depends on exactly what you're asking for, what you're going for, who your supervisors are. Anyway, it might sound strange, but it honestly didn't hold me back. I started posting on Instagram back in June 2022 after the idea came to me while I was sitting having an infusion on the day unit, a treatment to control the disease. I wanted to highlight that MS, or any chronic illness for that matter, was not the end of the road by proving that I was still living. After 5 grueling years of medical school, rounding off 11 consecutive years at university, I completed my foundation training this August. And you can see another picture of Dr. Matterson. Along the way, I lost my ability to walk, write, socialize, and even smile. On the flip side, I bought my first house, got married, and attained 4 degrees. Today, I still experience tingling sensations in both hands, making small, intricate movements difficult. I'm also prone to fatigue, and more recently, a poignant symptom that I suffer with involves trouble with my walking distance. Some people with MS have this experience where maybe they walk a short distance, they do okay, but then they develop weakness in the legs that's sort of inducible only with exertion. And that is actually quite common. This makes daily living challenging in some aspects, but I tend to build rest periods into my day, which alleviates this. Now I'm considering my specialty. I'm drawn to neurology, of course, but I sometimes worry that it would be too close to home. I'll never become a surgeon, that's for sure, but I have plenty of time to mull it over as I'll be playing patient for the foreseeable. This month, I'm traveling to London to undergo a hematopoietic stem cell transplantation, a pioneering treatment to try and halt the advance of my MS. And according to other sources, he did in fact complete this treatment. I posted this article some time ago on Twitter, and someone who I would consider to be highly reputable responded that they had actually met him in person and that he is in fact pursuing a career in neurology. And he mentions that he didn't think he could do surgery. Perhaps he had too much numbness in his hands. He didn't feel confident in it. But I think the general point here is even facing a diagnosis of MS, I think it's good to be optimistic. You'd be surprised what some people are able to do. I have some patients who are physicians who have had long careers with multiple sclerosis and other high-powered careers. One of my patients was actually a high school football player, and he actually went on to play at a top college. He didn't make it to the NFL, but he was a competitive college player. There's some professional athletes with multiple sclerosis and some people who are highly successful. Of course, no one can predict the future. It's good to have a backup plan just in case, but unless there's a specific reason you can't do it, like you have severe visual impairment and you want to be a fighter pilot, it makes sense to be optimistic and pursue your dreams. Anyway, it aims to reset my immune system by wiping it out with chemotherapy and then regrowing it using my own stem cells. I won't go into the details of hematopoietic stem cell transplant. I actually have a separate playlist on it if you want to check it out in the notes below. There are various different conditioning regimens with different side effects and efficacy levels. And he doesn't mention the specific conditioning regimen. It'll be a long, unpleasant slog, and there's no guarantee it'll work, but I'm prepared and know it's the right decision for me. I'll have to spend a lot of time in isolation, admitted to hospital. Leoanna, who I married last October, won't be able to visit, but we'll be doing a lot of video calls. After the treatment, you may be profoundly immunosuppressed for a brief period of time. I'll have to hang up my stethoscope for a while, but ultimately I hope the treatment will help me don my white coat for longer. There's this appeal that some people experience long-term indefinite remission after hematopoietic stem cell transplant, even though it can be quite toxic with significant risks. Where I go from here is yet to be seen, but regardless, don't ever tell yourself you can't do something. Not ever. And so I think this was a very inspirational story, an incredible story, so unfortunate, but he was able to turn it into something positive. And so I wish you luck, Dr. Matterson. Any comments or thoughts? Does anyone have any similar experiences where, although multiple sclerosis was a negative in your life, maybe it inspired you to do something positive? Maybe it changed the direction of your life in a positive way? And let me know if you have any ideas for other videos.